Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Probably easiest to track me down if you got comments, suggestions on LinkedIn. That'd be Eric Christensen, PharmD, BCGP, BCPS. Also reach out, mededucation101@gmail.com. And of course, as always, go to reallifepharmacology.com. Check out our free 31-page PDF. Simply get it for subscribing to the podcast. We update you with when new episodes are available, as well as some of the new content, new books, things of that nature, as well as some special discounts from time to time too. So definitely go check that out. Again, reallifepharmacology.com. Snag your free 31-page PDF. All right, so ibuprofen is the drug of the day today. I have previously covered NSAIDs in the past, but I wanted to dig into more specifics on this medication. So first off, brand names that you're going to see used in clinical practice: Advil and Motrin. Those are by far the most common, and you'll hear patients talk about these as well, so definitely a nice one to know the brand name there. Classification, it is an NSAID, as I mentioned, so it's got analgesic properties, antipyretic, so it can manage fevers. And that's really mostly what it's going to be used for. So pain relief, fever relief, as well as associated with that pain, obviously anti-inflammatory or inflammation relief there as well. Mechanistically, how it does some of those things. So ibuprofen's technically classified as a non-selective NSAID, which means it inhibits COX-1 and COX-2. Ultimately, that causes a reduction in prostaglandin formation, and if you remember, prostaglandins, specific prostaglandins, are responsible for causing pain, fever, and inflammation, of course. Now, in addition to reducing that prostaglandin formation, NSAIDs, and ibuprofen falls in that category, inhibits thromboxane A2. So by having that inhibitory effect on thromboxane A2, we can actually reduce or block or slow platelet aggregation. This increases the risk for that blood being thinner and increases bleed risk, which is why, we often hold NSAIDs before surgery, for example, and they're obviously, need to be used in caution with other antiplatelet medications or anticoagulants, which I'll certainly talk more about with drug interactions too. But that is, mechanistically how that happens there. Dosage forms and kinetics I did want to touch on, because this is definitely going to, have some variation from other NSAIDs. So with ibuprofen, it's one of the few that have liquid formulation, and dosing with this medication is 4 to 10 milligrams per kilogram per dose. And particularly with that liquid, we really, really want to be careful when we are instructing patients, caregivers, to dial up or basically measure out that dose, because very, very critical, because I've seen situations of incidental overdose because of inappropriate measuring. So again, very, very important that you go through that with the patient and they're taking the appropriate dose, particularly in pediatric patients. So the most appropriate way to dose that medication in our younger patient population is weight-based dosing. There are some variations, and you may see age-based dosing as well, which is probably acceptable in most situations, but by and large, I generally go with the weight-based dosing. So there again, make sure you've got an accurate weight and an up-to-date weight if you're going to recommend a specific dose to a patient. Dosing as far as the oral agent goes, and what I think most adult patients, say a relatively healthy 30 or 40-year-old, they've got some aches and pains or something, and they're going to take ibuprofen. One of the most important points to make is that ibuprofen does have a little bit shorter half-life than some of the other agents. So let's take naproxen, another common over-the-counter available NSAID. Naproxen's got a much longer half-life than ibuprofen. Ibuprofen's only about 2 hours. So we're going to have to redose ibuprofen a little bit more often. And that can be good and bad. If you are having adverse effects, those adverse effects are going to wear off more quickly. If the bad side of it is, patients need to be by their medication and take it more frequently throughout the day. So, can be some good and some bad with short half-life drugs, depending upon the perspective that you're looking at there. So adverse effect profile. Definitely wanted to take some time and go through some of the prescribing cascade things with you. So that's where we add a medication, we get a side effect, and then we add another medication to basically treat or manage that side effect. So GI bleeding, GERD symptoms, stomach upset, that is probably the most common adverse effect with NSAIDs, and that's, in ibuprofen. And that's why we try to take this medication with food. It can help with some of that or reduce some of that. So from a prescribing cascade, I've seen it so many times where a patient, usually an older patient, starts a medication like ibuprofen, and within days to a few weeks, all of a sudden now you see they're diagnosed with heartburn or GERD or something like that, and they get put on a drug like omeprazole, a PPI, or an H2 blocker to help with those symptoms. So really, really pay attention to the adverse effect profile of a drug like ibuprofen. Another classic example is CHF. So ibuprofen can cause fluid retention, and if you see escalating doses of diuretics or a new start of furosemide, for example, you got to go back, look, and make sure you recognize that a drug like ibuprofen can cause those adverse effects. Renal issues can happen. So patients may be particularly on diuretics and ACE inhibitors in combination with a drug like ibuprofen can really increase that risk of acute renal failure to a larger extent. So again, most of these effects are dose dependent. The higher the dose you use, the more frequently it's being used, you're more likely to encounter these things. Or if patients are on other meds, like I mentioned, that can exacerbate that risk. In addition to the ibuprofen, that's a big deal there. Now, there is a boxed warning for MI, and this is a broad categorization for all NSAIDs. So MI, stroke, things like that, NSAIDs have been shown to potentially increase that risk, and we do have a boxed warning. So that's definitely something to be cognizant of, and something to look at your individual patient and say, okay, how much risk are they going to be at? Are they already at high risk for cardiovascular issues? And what other options do we have to manage pain? So that can certainly be a challenging situation when you get out in practice, is weighing that risk versus the benefit there. One other thing I've seen in clinical practice is blood pressure. So again, kind of a dose-dependent effect. As we raise the dose, it's more likely to happen. But I have seen NSAIDs contribute, and ibuprofen contribute to resistant hypertension. Okay, so if you see a patient with escalating blood pressure medications, maybe amlodipine or lisinopril, and you're maybe not getting a response you think you should be getting, that could be a situation where a drug like ibuprofen is contributing to that hypertension. There also was a recent newer update in pregnancy, and that was a special FDA alert. It is considered an update, not necessarily a boxed warning, at least at this point in early 2021. But that is a special FDA alert on fetal kidney problems and development. And usually that's, so far, what they've seen is 20 plus weeks gestation. So important to think about that and think about the use of NSAIDs and the potential inappropriateness of using it. Again, kind of going to depend upon what other options we have. And, you know, in my perspective as a pharmacist, I play it pretty safe when it comes to pregnancy and using medications. And it absolutely must totally outweigh, the need must totally outweigh any potential risks to that fetus. So that's definitely something you're going to want to keep tabs on with the use of NSAIDs as maybe more data is found out regarding that special FDA alert. All right, so let's take a quick break from our sponsor. We'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like NAPLEX, ambulatory care, medication therapy management, pharmacotherapy, or geriatrics, definitely go help support our sponsor, meded101.com/store. In addition, if you're a nurse, dietitian, physician, PA, nurse practitioner, we've got all sorts of different resources, books involving case studies and clinical pearls. And you can find all those links at meded101.com/store. Also, take advantage of our free Audible book. So if you've never tried a book on audible.com, you can actually listen to one of mine for free and get the whole 6, 8, 10 hours, depending upon the book you select. Pharmacotherapy, Thrill of the Case, or my latest Audible book on drug interactions. So go check those out for sure. All right, so finishing up on drug interactions, the first one I think about and I see a lot of is the GI bleed risk. So I mentioned anticoagulants, antiplatelets. These can have a cumulative effect and thin out that blood even more with an addition of a drug like ibuprofen on board. ACE inhibitors, ARBs, diuretics, those work on the kidney. They can cause acute renal failure on their own, but combining with ibuprofen and its renal effects can increase the risk even further. So be really, really cautious. We need to be monitoring creatinine and kidney function as we're using NSAIDs. Really, really important thing to do. In addition, older patients are going to likely be at more and more risk as they get older in combination with those other meds too. Hypertension meds, so that's kind of a general opposition type effect where ibuprofen can raise blood pressure and oppose what we're trying to do with meds that lower blood pressure. Lithium, used in bipolar disorder, concentrations can be increased with the use of ibuprofen. Definitely one that I have come across in clinical practice. And again, the accessibility of ibuprofen, it being over the counter, you see a lot of situations where healthcare providers, pharmacists, physicians, whoever is helping to work with that patient, things get missed because the patient goes and they start taking this medication on their own. So very, very important to remember to educate your patients, to ask questions, and remind their healthcare providers that they're starting a new medication and ask for permission, even though it is over the counter, because there are a ton of drug interactions with ibuprofen and obviously a lot of the NSAIDs in general. More along the lines of GI risk, GERD, GI bleed risk, bisphosphonates, the oral bisphosphonates like alendronate, that can potentially have some additive effects on that GI bleed risk, esophageal ulceration risk. Corticosteroids can be kind of hard on the stomach for some patients and again may increase that risk for GI adverse effects. And then lastly, I mentioned the CHF risk. We could potentially oppose some of the beneficial effects that we're getting from a drug like furosemide in trying to run off fluid. A drug like ibuprofen can potentially oppose that benefit. All right, so that's going to wrap it up for today. If you enjoyed the podcast, leave a rating, review on iTunes. Thank you so much to those of you who have already done that. Go sign up, reallifepharmacology.com. Get that free 31-page study guide on the top 200 drugs. Great little resource if you're taking pharmacology courses, taking a board exam soon, or just need a quick refresher. Also, share us. Friends, colleagues, students, definitely share the podcast, help spread the education around. So again, I'm Eric Christensen, pharmacist, signing off. Track me down on LinkedIn or mededucation101@gmail.com. And I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.